Welcome back to Mouth Matters with Dr. Dom. I'm so grateful that I have my favorite guest back with us today, the one and only.
Where's he at?
He's behind the plant. Mark Riccadonna, everybody.
Hey,
Welcome back, brother.
Thanks for having me, man.
Thanks for taking the time.
Happy to be here.
I can't ignore it. I have to look at your shoes. I have to talk about your shoes, right?
And my Vans Halen.
The Vans Halens.
I know you always seem to have amazing shoes, so I thought I better step my game up from them dirty canvas ones.
You got me beat today, bro. You got
I don't
me
know.
beat.
You look like you're stepping on water balloons.
This actually is the largest air pocket of any Nike shoe there is. Not that I'm trying to, be too extra or anything like that.
You're ready to break a record.
Yeah, that's right. Record-breaking news. But yeah, these are the Air Force 270s. I like them. The only thing is, I don't know if they're marketed as a running shoe or not. I like them for walking around. I ran in them one time, and I think it kind of messed up my knees a little bit. So, word to the wise: if you like to run, don't run in these, but they're good for walking around. So, getting into Mouth Matters, we have a question right here from Jennifer from Texas, and her question is: we just had a newborn baby. Congratulations, Jennifer. And we wanted to know when we should bring him in for his first dentist appointment.
I wouldn't have known. My wife luckily did, but I still don't remember.
Well, Ange, I feel like no, is a little bit more on the cutting edge of parenting than.
If it wasn't for her, the kids would still both be in diapers, and they would just still be sleeping in a crib.
They take after their father.
Yeah. Like a baby, I usually put myself in one bottle.
So anyway, the answer to the question. Do you know the answer?
I do not.
Ideally, we like to see them when they're 2 years old. Not that we're really going to do anything. It's just that at 2 years old, almost all the baby teeth should be in, and they have a full set, and that's when we can take a look. And that's kind of when they're starting to develop a little personality, where you can kind of reason with them and say, hey, can I take a look? And all I'm trying to do at the age of 2 years old is just look and make them, make the kids comfortable here. Because when you bring them in the first time and they just have fun and they're talking and they get to see all the new things, it's not threatening, So if you get them used to that, then all of a sudden it doesn't become such a big deal obviously when they need the cleaning. We'll try to polish the teeth when they're here, when they're 2 years old. But if we can't do it, no big deal. We never push the envelope. And I think that most dentists out there subscribe to that idea. And then when they come in and they start getting their teeth scraped on and everything like that, it's no big deal. So have you experienced that? How the boys?
So when we brought Axel by himself, he's the 4-year-old when he was just 2. He wasn't comfortable opening his mouth and letting him dig around or do anything, but he eventually came around, and then his second time in, he knew what was happening, so he was very cool about everything.
He's chilling. Did either of the boys ever have like a real filling?
Yes, Axel did, actually, in the front tooth.
How'd it go?
He cried, but it wasn't because of any kind of pain.
Mm-hmm.
It was before the drill even touched him. He just knew something
the anxiety.
Was up. Something was up.
That's what happens. They feel like they know they should be afraid of something. Yeah. It's what it comes down to.
Yeah, and then our youngest Duke, he was all about it. He didn't care. He opened right up. He knew the dentist was doing their thing. He let him do it, and then he knew he was going to get a toy after, so he didn't give a crap. And
just like adults, all kids are different. I'll sometimes if I can't, because people ask me, what age will you start seeing them? What will you do fillings on it? I have a 4-year-old. We have a 5-year-old. Are you willing to do that? And my answer is usually the same. Always the same. Is that we're going to give it a try. And and by giving it a try, I mean just I'm going to go sit down with them. I'm going to explain everything that's going on. I'm not like. Other than I don't say this in the office, but other than the needle, I don't hide anything, and I'll show them the drill, I'll show them my tools, and most of the time that kind of.
I think it's even with adults. Once you kind of know what's happening, or you can relax and calm down and let you do your thing.
I have a few favorites, a few favorite patients, and usually it's either my oldest patients or my youngest patients. For some reason, I don't know what it is.
Probably it's because I do the same things.
Exactly. Yeah, I get kisses from the old ladies and the little. I have a little girl who's a patient. She always gives me a kiss on the cheek too. So, but she tells everybody I kissed her first. I said that's not the message we're trying to spread. This is not what we're trying to go for here. So there's that, but. I love answering questions about.
Oh wait, now my 4-year-old grinds his teeth at night.
Mm-hmm.
When he's asleep, you can actually hear it. You can hear it, and it's like, is he like a chipmunk?
So here's the deal: for kids, especially at that age, it's normal for them to grind their teeth, and that's something that if you hear that, like Mark's been hearing at nighttime, maybe if your walls are thin, you can probably hear it through the wall. It's alarming to think about that your child is.
Oh, it makes my blood go cold.
Right. It's not a fun sound or a fun thought, but for kids that age, it's actually normal. And that's a question that I get a lot actually. But not to change gears from children to adults, but I know that in the past, just because you've been a patient of mine, that you've had questions about grinding and stuff like that.
Yeah.
For the sake of our audience, could you kind of get into what you wanted to inquire about that?
So now I had TMJ when I was in acting school. They want you to be able to open your mouth and get as much sound out as possible. So I
never a problem.
I'm very good at it now. People wish I would tighten up a little.
Never.
So I would kind of clench my jaw, and then I grind right in the front area and the very back, and I'd have these tight, and they gave me different things to rub and to massage your jawline and that kind of stuff to slow it down, but also to stretch.
Yeah, that's true. It's just like any other muscles. We do need to stretch and we need to loosen them up. Except sometimes when we focus on stretching them like that, we're actually kind of almost making the inflammation worse sometimes when we try to do that kind of aggressive full stretch kind of thing, and that actually will kind of almost add tension because when you're trying to open so hard, there are 5 muscles, 5 sets of muscles that close the mouth. There's only one set of muscles that actually opens the mouth. So the ones that close them are already hurting, and if we're constantly doing that lateral pterygoid muscle that is the one that's responsible for opening the mouth can kind of get worked up too. So that's not always the best. What you want to do exercise-wise, and you're going to laugh at me, and this is from Dr. McCammett, the guy I bought my practice off of, and he's 46 years of experience in dentistry. His favorite thing to tell people is to cluck. So literally, and that opens your mouth just enough, and it moves all those muscles enough. Because if you watch my muscles, and for the people at home, if you want to kind of hold your jowls and your cheeks, right on your lower jaw when you're doing this, you can feel a bunch of muscles moving. So that's a great thing to do. So there's one thing, but the grinding issue at night, which this is a whole subject that kind of drives me nuts, because the solution is a night guard, okay, but not all night guards are made equally. It's true. It's true. They have to be all hard, meaning that they can't have any cushion to them. The ones that you see in the store, I don't know, maybe a brand is Dentamax or something like that, are these soft night guards, and it's our natural intuition to think, a soft night guard's the way to go because it's not beating on my teeth. It's no big deal. But the issue is it's just like a piece of gum. It has give. So every time that you chew think of a piece of gum. Every time you chew into a piece of gum, you want to chew again. So it's the same thing with those soft night guards. If it has that give, you're going to want to keep doing that. So it's going to make it worse. It's going to make your muscles more sore. So what you need to do is go to your dentist. And this isn't just because I'm out to help dentists out there. It's you want to go to your dentist and you want to get a professional night guard done. And some dentists, I don't know why, they'll do soft night guards. Make sure you specify that you want a hard night guard, because a hard night guard, think about it. If when you try to bite, you're like this. And eventually, because it won't let you close all the way, eventually it's going to take out that reflex of wanting to chew more. So that's my insight in the situation. I've been trying to just
get my wife to let me go to a massage parlor and take care
of it. the massage bill might go up quickly. Where's Mark? He's still getting the massage.
The pain started here and it ended in.
Well, give me. I don't like putting you on the spot, but I'm going to put you on the spot. I want to hear. I want to hear the first joke that pops to your head here.
Like a street joke?
Anything you want.
Oh boy, let me think of something that's appropriate for the audience.
Nothing's appropriate when it comes to you.
We may have to cut this out.
Okay, go ahead, give it to me.
A guy goes to the urologist. He's getting an exam, and the doctor says to him, "It's very peculiar to have an erection during an exam." And the patient goes, "I don't have an erection." And the doctor goes, "No, but I do."
I face that problem all the time. That's ridiculous. That one, I'll tell you, that's in the book. We're not cutting that, by the way. That's fantastic, brother. That is fantastic. Having Mark around gives me the levity that I need in my life, man. You balance me out, bro. I wish we could get you to move back home full time, bro. It's so fun spending time.
I love coming home. It's so much fun.
I love it too.
You took me to a couple of golf courses. Now you're an avid golfer. What's your
history on golf shirt on today?
What's on the pocket?
So this is actually top 3 courses that I love. This is Mid Pines. It's in Pinehurst. It's not one of the Pinehurst Country Club courses, but it was designed by the same architect, Don Ross, that designed Pinehurst. Just a beautiful place. But
now they don't sponsor Dom, but they could.
They could rep. They could rep all day. But we started. We started going on a trip down there. I go with my uncle and his friends and everything, and it's a good time.
How did you get started in golfing?
It's my dad, and my uncle, and it just so happened that the same year that I started playing golf, I was 7 years old. That was 1997. I was 7 years old. I'm 28 years old. If anybody's wondering, that's the year Tiger Woods won the Masters.
Oh wow!
And it kind of took the whole world by storm and everything like that. So
golf became very hip.
It became cool, and as if that wasn't enough. Where I live, my backyard is a golf course.
Golf course, yeah.
Great people who own the golf course always let me play, basically as much as I want. I think they lost money on me, but kind of what I want to, close in on in our thought process here is just like, this is a chance for people to see the other side of my life. You know what I mean? For hanging out with my friend Mark. Blowing off steam at the golf course. So it's like when you come in to see me or go to another dentist or anything like that, there's no need to be like freaked out. You know what I mean?
You're a regular dude.
You get this, people get this tunnel vision that I'm trying to do whatever to them. Or
you're a regular dude, but you happen to be a very, very good golfer.
I'm okay. I'm okay.
Let them know about your past.
Well, I played in high school, played in college, Division II, and I had delusions of grandeur that maybe one day I was gonna be able to play on a higher level than just that. But I think to quote the NCAA Division II tagline, I went pro in something other than sports, thankfully, or else I wouldn't be able to. Wouldn't be able to afford these shoes I'm wearing because I wouldn't make a dime. But thanks, guys, for listening. Once again, if there's any questions, anything you have at home, we want to hear it. We want to know what you're thinking about. If you have any questions about me personally, feel free to ask. I don't know if I'll give you a good answer. And maybe if we have Mark on again, we can get another good joke out of him like you gave us today. So,
yes.
Thank you so much, and we will see you next time.